Trump wants to toss out Obamacare, or the Affordable Care Act, as it's more properly known. In its place, he wants to put in what should be called the Unaffordable Care Act and be nice to a billionaire plan. Trump says it's a great plan. That title is shorter, so let's go with it. The Great Plan. Now, you might wonder why I mentioned billionaire. It's not well known, but one of the ways Obamacare is paid for is with some hefty taxes on wealthy people. Under the Great Plan, all those taxes would be gone. The folks in the 1% would get a savings of $33,000 a year. And get this, John McDonough of the Harvard School of Public Health says that under Trump's Great Plan, the 400 wealthiest households in America would each get a tax cut of $7 million. But remember, under the Great Plan, your rights are restored. You get the right to have no health insurance at all. The people who get hit the hardest under the Great Plan are low-income, single persons in the years before they get Medicare. The head of the AARP, the American Association of Retired Persons, and I'm a member, said the worst off would be someone who makes $15,000 a year and was 64 years old. He or she would be facing an increase of $8,400. Get that? More than half of their income gone in an instant under the Great Plan. A magical theft done right before your eyes. It's obvious something real bad is going to happen to health care this year. So what should we be working for in the years to come? The solution is not a return to the high-priced, confusing Obamacare, which after years of implementation still left tens of millions of people uncovered. What we need is what they have in Canada or Britain. No insurance at all, but instead health care provided without any bills or paperwork by the government, and all paid for by taxes. In the U.S., the proposal goes by the name single payer. If it was adopted, you'd have the absolute right to take the coverage or reject it. It doesn't get any freer than that. It would cover everybody and cost the country much, much less. Ralph Nader and Bernie Sanders have been calling for it for decades. Single payer.